The following is intended to be an educational resource for you and your family regarding brain injury, concussion, and the NFL Concussion Protocols.
There's no question that concussions are serious injuries.
No, boy, you can see him hit the back of the head.
But the more important thing is brain health over the course of a lifetime.
This is really serious stuff. This is your brain. This is your mind. This is you. Don't risk you.
All of us as players would say that there was such a lack of education growing up surrounding concussions and the amount of times that we had our bell rung.
That was a tremendous amount of pressure when we played, when we had to play hurt.
So you just keep going and you keep pushing through, and it does affect you differently than it would an orthopedic injury.
The term concussion has been overused, oversimplified.
Part of the problem is that concussion is widely referred to as anything that happens to the brain. And in fact, it's really a very specific kind of injury occurring over a very specific time. Concussion is a change in the way the brain works so that it's not working as effectively as it did before.
Concussions occur anytime the brain experiences a force. So that can be from a direct blow to the head, that can be from a blow to the body where your head moves around quickly, that could be from your head striking the ground.
That helmet to the ground, still one of the troubling spots when we talk about concussions at the NFL level.
Neurologically, the brain reacts to a concussion by the circuits being jammed, being unable to process information in the normal way that it would be, and that produces a number of symptoms downrange. It requires an experienced physician to be able to examine the patient. This is then compared to their baseline. You know, if somebody's got bad balance, he's going to have bad balance with a concussion or not. No two concussions are the same, even within the same player.
This makes diagnosing concussion difficult because there's not one pattern to recognize.
So the idea that, you know, I've got symptoms, but it's not like the concussion I had last year, doesn't mean it's not a concussion. It means it's a different concussion.
Right there, that knee to the helmet. That's where the concussion protocol is going to come into play.
So once a potential injury has been identified, the NFL and the NFLPA have worked together to create evidence-based protocols that will take you through a process that ensures that you are safe to return to play. Whenever a concussion is suspected, the player is required to be immediately removed from the field of play and evaluated as soon as possible.
The full NFL sideline concussion assessment comprises several different pieces.
People will be asking you questions about how you're feeling, what your memory may be, and then there will be a series of questions designed to get at how is your brain working, as well as some physical examination maneuvers also designed to look at brain health. When we are trying to evaluate somebody for concussion, what we think of are the big six.
A group of neurosurgeons, emergency physicians, and neurologists sat down and said, what are the 6 go, no-go, the big 6 to say, if you have this, you can't go back into the game.
Loss of consciousness or unresponsiveness, confusion, amnesia,
abnormal neurologic findings, new or persistent symptoms, or progressive symptoms that occur over time. When you go through the big 6, that's just the first screening exam, because you can be completely normal on all of those and yet still have a concussion. That's why the exam itself is much more detailed than just the big 6.
The people who are involved with the full assessment of concussion are the unaffiliated neurotrauma consultant and your team physician. The unaffiliated neurotrauma consultant is an independent physician who is there on your behalf.
They have one job and one job only, and that's to make sure that you're good to go. In the event that a player doesn't have signs or symptoms of concussion, but is identified by a mechanism of injury, a potential big hit to the head that might result in the concussion, or players who have stingers or burners and have helmet contact, and that can be identified by a number of different people on the field, meaning the coach, player or teammate, a referee, the trainer, the booth trainer, and then 2 physicians, the team physician and the UNC. A couple of things happen. They're going to ask you what happened. They're also going to ask you questions which are called the Maddox questions, and they're going to go look at the video replay. On the sideline, they're going to take you aside and they're going to examine you, and one of the most important things is that this is then compared to your baseline. If the sideline examination shows, you know, we better take a closer look, off to the locker room and you get the full examination. If not, back to the game, and we'll keep an eye on you for the rest of the game.
When you are concussed, there's really a state of vulnerability there, where if you continue to play or get hit again, that simple injury can become much more severe.
They're going to pull them out. This is not up to the team right now to be able to make this decision.
You can be tough and still, in a moment, be hurt or injured enough to come out of the game.
Your skill is what's going to keep you on the field. So don't be afraid if, in fact, you ever face a concussion. to speak up about it?
Simply going to the athletic trainer or the team physician, letting them know, hey, I got ringing in my ears after that hit. I'm seeing double here a little bit. I think I need to be checked out.
Players who let their medical staffs know about symptoms sooner will spend less time away from the game. If you don't let somebody know of your symptoms and you continue to play, you will turn a 4 or 5 day injury into a 10 or 14 day injury. The sooner you tell us, the sooner you're going to get back on the field.
You're seeing more and more every year that a player is willing to leave the field if he has an injury that's going to keep him from being at the top of his game.
The Return to Participation Protocol is a 5-step series of graduated increases in the amount of work that you're doing, starting with rest, moving up through light aerobic, adding weights to that, adding football-specific activities. The 5th is full football activity, which is contact. 3 other things have to happen. They have to have a return to baseline of their neurocognitive test. They've got to be cleared by the independent neurological consultant, and they've got to be cleared by the team physician.
And it's important to remember that as a patient, you have a right to a second medical opinion. You should never participate in football after a concussion unless you've been evaluated appropriately and if you are not having any other symptoms.
So any questions or concerns about the protocols, how they're done, were they done properly, talk to your player director. They're going to get in touch with Team Health and Safety for the NFLPA, and we'll be all over it. We're here for you. The best practices for a player to follow: make sure that you've seen the physicians that you're supposed to see and done the tests that you're supposed to do. But you also have to both look inward and look outward. Look in the mirror and say, am I ready to go back and play this game at this level?
One of the most challenging aspects of this injury is that players who are concussed are not always aware that they are. They may be acting completely inappropriately, not have any memory, being unable to perform their task, yet completely feel they are fine. You may not feel the symptoms right after a hit, or even a few minutes or a couple of hours after a hit. And in some cases, even the symptoms won't begin until the following day.
Check in with your loved ones, people that eat breakfast across from you, that you see every day, to find out, do I look okay? How does it seem to you that I feel?
There's no question that playing football involves a lot of risk, a lot of repetitive hits, and brains experience a lot of force over the course of a career.
Just like every concussion is not the same as the next one, even within the same player, the effects on the player are different depending upon the player and depending upon the types of hits that they've had.
I know it could be a confusing issue, so if you have any other questions or concerns, please reach out to the NFLPA Health and Safety Team.
We've seen much more of a positive response to these resources and to these initiatives.
All the people that are watching this game are trying to make it safer and trying to make it easier for a player to, if he has a concussion, to have it diagnosed and treated properly, and if possible, prevent those concussions in the first place.
In your opinion, what's the biggest NFL obstacle for solving concussions?
The mindset of players. Players feeling comfortable self-monitoring, and if you have one, telling somebody about it.
Do your best to be as educated as possible surrounding traumatic brain injury, surrounding concussions, so that you can make the best decision for your body going forward. Over time, we will see that culture change, which is going to make the game safer. We want to be pro-football, and we want to be pro-brain.